Today, first, we're delighted to inform you that we have discharged the highest number of patients in a single 24-hour period. We have discharged 175 patients from the various facilities who have recovered from the coronavirus disease. This brings the total number of recoveries to 1,048. We shall be failing if we do not recognize the good work of our healthcare workers, whose effort and dedication has made it possible to record these many recoveries. I urge you to join me in appreciating our healthcare workers for this wonderful achievement. Regarding the statistics of cases in the last 24 hours, we have recorded 105 positive cases from a sample of 2,273 tested over the last 24 hours, which brings the total number of confirmed positive cases to 3,094 from 102,956 samples tested so far. So we, as said yesterday, we have already crossed the 3,000 mark. Out of today's cases, 96 are Kenyans and 9 are foreigners. 77 are males and 28 are females. The youngest is 2, the oldest is 77. These cases are distributed in the following counties: Nairobi with 43, Busia with 18, Mombasa with 11, Turkana 7, Migori 6, Kwale and Kiambu 5 each, Kilifi, Machakos and Taita Taveta 3 cases each, Kisumu 2, Uasin Gishu, Siaya, Kajiado and Garissa 1 case each. By sub-counties, in Nairobi, the cases are from the following sub-counties: Ruaraka 14, Langata 5, Dagoretti North and Kamkunji 4 each, Embakasi West, Embakasi East and Kibra 3 cases each, Starehe and Westlands 2 cases each, Makadara, Mathare and Embakasi South 1 case each. In Busia, all the 18 cases are truck drivers at the Malaba border point. In Mombasa, the 11 cases are from Kisauni 5, Likoni 4 and Mvita 2. In Turkana, all 7 cases are of truck drivers at the Nadapal point of entry. In Migori, the 6 cases are from Kuria West 4, Nyatike and Suna East 1 each, while in Kiambu, the 5 cases are from Ruiru 2, Kiambu Town, Juja and Lari 1 case each. In Kilifi, all the 3 cases are from Rabai. In Machakos, all the 3 cases are from Athi River, while in Taita Taveta, all the 3 cases are of truck drivers at Taveta border point. In Kisumu, the 2 cases again are of truck drivers in Kisumu Central, while in Uasin Gishu, the 1 case is also a truck driver in Tarbo. In Siaya, the 1 case is from Rarieda. In Garissa, the 1 case is from Dadaab. And in Kajiado, the 1 case is from Kajiado East. Of course, we now and then are saddened when we lose a patient, and today we have lost another one patient to the disease, bringing the tally of deaths to 89. The patient was in Nairobi in one of the hospitals here. I send my heartfelt condolences to the family of the departed. As you will note, we are seeing more and more truck drivers turning positive, and the issue of truck drivers at the various border points, particularly the border points with the Uganda border at Busia and Malaba, have remained of great concern to us. And as a ministry, we are working very closely with the county government of Busia to provide them with the support and necessary support that they may need for us to jointly address the situation there. Fellow Kenyans, let me now say a few things about home-based isolation and care that we have talked about before. While the World Health Organization recommends that all laboratory confirmed cases of COVID-19 be isolated and cared for in a healthcare facility, it also recognizes that not all cases can be cared for in a health facility when the numbers begin to rise, and that prioritization of hospitalization and alternate care systems need to be explored and considered. As you are aware, due to our rising numbers of COVID-19 cases, it is increasingly becoming untenable to isolate all patients in our health facilities for management and care. We are glad to inform you that today we are launching our home-based isolation and care guidelines for patients with COVID-19. This guideline is available on the Ministry of Health website, and I encourage you to look at it, download it, and look at it so to get a clear understanding of what it entails. This protocol has been developed to provide a solution in the management of the increasing numbers and the anticipated surge in COVID-19 cases. Currently, according to the available data that we have, 78% of infected persons, that is positive cases, admitted in our hospitals are either asymptomatic or mildly symptomatic, and therefore can be managed at home, provided proper laid down procedures are followed.
They said we are working on a standardized testing protocol within the member states so that mutual acceptance certificate is actually valid. So the certificate as we are issuing now, and I say just as drivers are able to move across without a valid certificate, Kenyans are Kenyans and they will probably try it. We have tried to serialize it, and we have issued the authorized signatories of those certificates to those who are supposed to be signing them. But again, as I say, the police officers have this information, so don't try, you may be nabbed. But as I said, Kenyans are Kenyans and they will try. But we have that system, and hopefully before the end of the week, we will be able to roll out the digital system that has digital information that you can use even a mobile phone to decipher. So moving forward, we hope that issue of validity certificates will be dealt with.
We have 781 patients admitted across our public and private health facilities. Out of the 781, 7 are critical. They are in ICU. 4 are under intubation, and 2 are under ventilation. I think the only thing I would add to that, we have over 85 over 85% of our patients leave ICU. And therefore this shows how good and how effective our healthcare workers are in our facilities. And we will continue thanking them for their effort and for all that they are doing. Thank you.
Is this the case, or do we expect the symptoms probably to be serious, because most
COVID patients who went to Lancet and the result.
The track